I'm going to pivot now to lymphedema therapy itself, which is really where we're narrowing our attention this evening. And what is lymphedema therapy, and what can we imagine for it for the future? This here is my stump speech, if you will, as we slowly enter a new political season. These are my contentions about head and neck lymphedema, and I want to share them with you. Head and neck cancer-related lymphedema is in some ways similar and in some ways different than breast cancer-related lymphedema, which is the disease that is so much more well known. So how is it similar? Well, we've mentioned, again, the role of radiation and then the late effects of radiation causing fibrosis, edema in and of itself being one of those symptoms, but really not the whole story. In fact, you know, I've always railed against the moniker of lymphedema because it really pigeonholes a cascade of side effects and symptoms that patients have into edema. Edema is just one of those problems, but it is often a proxy symptom for more problems coming down the road. But there's a great similarity between breast and head and neck cancer patients, but there's also differences. In head and neck cancer, the treatment is primarily aimed at the mucosa. In breast cancer patients, there's no mucosa. In head and neck cancer patients, we know that lymphedema, or even we could say swallowing and its relationship to lymphedema, gets better as the day goes on. So head and neck cancer patients don't swallow well in the morning. They swallow better at night. Why is that? Well, it's because of gravity. We know that gravity is our most primordial lymphedema pump, and patients, their edema in the head and neck improves as they are standing upright all day long. And this is in distinction to breast cancer patients, where the edema in the arm gets worse as the day goes on because the arm is dependent as they're walking around all day. My second bullet point here, lymphedema in the head and neck really does not have good metrics to identify it. We have a hard time knowing who has it, when are they getting it, where are they getting it in the head and neck, and how bad is it? We just don't have a very good metric system for head and neck lymphedema. Bullet point number 3. Too many times I hear lymphedema being relegated to the swelling that occurs underneath the chin in the submental area. And that's lymphedema, and if that's what they're here to complain about, then they're doing great because they've been cured of this cancer. Well, that's really, to us, a proxy symptom for lymphedema. It is really the tip of an iceberg bobbing in the ocean. Lymphedema is much more than that. It's a sign of internal lymphedema, which can have swelling, which can have implications to speech and swallow. The fibrosis can lead to pain, intrismus, not to mention airway obstruction. Many patients in my practice over the years who don't have cancer but still have a trach because their airway is so edematous. And we head and neck surgeons often call it post-treatment changes when we scope those patients. But what we really should be calling it is internal lymphedema, which is what it is. Lymphedema also is not limited to the superficial planes of the neck. In fact, it's probably worse at the places where the treatment is most intense, and that's really the mucosa. So again, it's the interstitial fluid collecting in the submucosa, which is really most impressive, but we're looking at the patient from the outside and see a swollen submental neck, and we call that lymphedema. We got to take a look on the inside to really see the lymphedema. And then finally, this movement of lymphatic fluid, which is really the beginning of this cascade of side effects from radiation and surgery, is much more random than we thought. Different patients are different cancers. If you have bilateral neck disease, let's say, as opposed to a patient with a very small burden of disease on one side, did you get radiation on both sides or one side? Did you have surgery on both sides or one side? How was the radiation field drawn? How was the incision drawn? These are all factors that can affect the way lymphatic fluid moves. And so lymphatic fluid is very complicated, and lymphedema therapists will tell you that as well.